So if your glasses prescription keeps changing every year, you're not alone. Now, we work in quarter diopters of steps, you can think of quarters of dollars, and a 25, 50-cent change every year is considered normal. If we're having beyond that though, then we've got a problem possibly. And so this video is going to talk about the different things that we're going to look for. So to start out, nearsightedness is when the curvature of the cornea is either too steep or the eye is too long. And so as we get older, the eye is going to get a little bit longer. And so normal progression happens. A 6-year-old is not going to be as tall or have as long of an eye as a 15 or 20-year-old. And so that progression happens naturally. And that's normal why we should expect changes. Now, you might be saying, well, I'm an adult and my prescription keeps changing. There are other factors as to why our prescription can change. So it could be that the cornea is getting swollen or getting thinner or just changing shape slightly. It could be that the lens inside your eye is becoming a cataract or shifting around just a little bit. It could be that your ciliary body is getting jam-logged a little bit, getting kind of stuck. And so there are other reasons why our prescription change, but the main reason why individuals are nearsighted is because the eye is too long. Now, it's not majorly too long, because if you're just 1 millimeter too long, then lo and behold, you can't even see the big E without glasses. Now, other aspects can cause it to change as well. Genetics, if mom and dad both were extremely nearsighted, their eye was extremely long, then that may play a factor in it as well. The amount of time you spend outside actually is correlated with nearsightedness progression. The more time spent outside, the less likely we are to have progression. The less time outside, the more likely we are to have progression. Then there's also the amount of near work you're doing. If you're reading all the time, staring at a computer all the time, research has shown that all that extra near work can cause us to become more nearsighted. Living in urban environments, if you're not living out in the country, if you're living in the big city, research has shown that you are more likely to become nearsighted because you're inside or in those big cities more than likely on average. Now, there are times when that change in prescription can make us eye doctors nervous, can cause you patients to be more concerned, and those are the scenarios where I'd really encourage you to come in. If it's a sudden change, it's not this gradual, slow change. It feels like it might be a little bit fuzzier than it was 6 months ago. If it's like, oh my gosh, no, it is really blurry today and it was not yesterday, that is a cause of concern. If you tell me it's unequal, meaning my right eye is really fuzzy all of a sudden, my left eye looks really clear, that could be a major problem. If you're having flashes of light, floaters, those are always major concerns. And so anytime I have patients that tell me that they have new flashes of lights and new floaters at the same time, man, I want to see them same day if possible. And then if there's weird distortion, instead of lines being straight, if there's this just weird waviness to them, that could indicate some problems with the macula. And so really would encourage coming in and seeing in those scenarios much faster than just your regular exam. So what are things that I can do to try to slow it down? There's going to be some natural progression more than likely, and there are things that we can do to slow it down. The Stellest lens is one thing that we're talking about right now. Research has shown that it decreases progression by 70%. There's atropine drops. Low dose of a dilation drop can slow that progression down as well. Spending more time outside, wearing the proper prescription. If our prescription is old, out of date, not exactly what we need, research has shown that can cause us to get a lot worse as far as progression is concerned. And so wearing that proper prescription. And then lastly, if we are getting that proper care, are we getting our eye exams checked every year, every couple of years? Are we staying up to date on those things so that we can know what actually is changing and when it is happening? That way we can be a little bit ahead of the game, because an ounce of prevention is worth a pound of cure. If you like these videos, please subscribe to the channel. That way you'll get notification when I do the next one. If you have any extra questions about what I've talked about, if anything was unclear, leave a comment at the bottom. That's actually how I find a lot of my video topics.